Thousands of healthcare workers across New York, including in the North Country, protesting against Governor Kathy Hochul's proposed 2024 state budget.
The group says it neglects major healthcare needs. NBC5's Tyler Boronsky joins us now from CVPH in Plattsburgh, where some of those workers spoke out about the issue. Tyler, what did they tell you?
Yeah, Brian Oswald, healthcare workers are saying the proposed budget doesn't grasp the current state of New York's healthcare system, and they're asking the governor to narrow the Medicaid coverage gap. Healthcare workers rallying to have their message reach Governor Kathy Hochul's office. The workers say her proposed 2024 budget hurts the healthcare industry, especially in the North Country.
It's important that we maintain the jobs, we maintain the care, and where are our patients and our residents going to go if they don't have local access to health care?
They say the aftermath of the pandemic has not been addressed and is still affecting them to this day, citing issues such as emergency rooms overflowing, long wait times for home care services, and safety net hospitals and nursing homes not receiving the funding they need.
I've watched small hospitals close, and now the community, people have to travel over an hour to get quality health care.
One of the biggest issues North Country advocates are fighting for is narrowing the Medicaid coverage gap. They say upstate New York receives 25% less compared to other parts in the state because of their patient numbers. Governor Hochul's budget includes a 5% statewide increase in Medicaid reimbursement, which would be the largest increase in 2 decades. Some healthcare officials and local elected officials say that increase is entirely offset by the elimination of the 340B drug pricing program and the cut of the indigent care pool. North Country folks are asking the governor to increase Medicaid reimbursement rates by 10% for hospitals and 20% for nursing homes with no offsets, which they say is more than fair.
I cannot think of a company that would stay open that gets paid 75 cents for every dollar spent. How does it buy supplies, invest in technology to improve care, and pay its employees when it never gets fully paid for the work the hospital or the nursing home provides?
In a statement to NBC5, Governor Hochul responded to the statewide protests, saying fiscal year 2024 executive budget takes steps to expand coverage, improve health outcomes, and reduce unnecessary financial burdens on our state's healthcare system. However, New York Assemblyman Billy Jones disagrees and is hopeful Governor Hochul will readjust her proposal with their counter suggestions.
This is a very reasonable proposal to close that gap. We didn't ask for it all at once, but we are closing that gap. And certainly we don't want to see zeros with it widening.
And officials from the 1199 SEIU, a local healthcare union, also say they're hopeful the governor will consider their proposition, as they say their points are necessary if they want to keep quality healthcare available in the North Country. Live at CVPH in Plattsburgh, Tyler Bronsky, NBC5 News.